All right, so I am pleased to introduce Dr. Brandon Kohrt, who is the Charles and Sonia Achman Professor of Global Psychiatry at George Washington University, where he directs the Center for Global Mental Health Equity. A psychiatrist and anthropologist, he has spent 30 years improving mental health care in low resource settings, and he is going to moderate our panel for the next person. Over to you, Brandon.
Thank you very much, Sarah. And a huge thanks to Pamela and the team that has organized. Just really enjoyed the conversations over lunch. This is an amazing group of people to bring together so many strong youth voices as well. So I just want to thank Pamela for organizing this incredible time together. So as you see, we've drawn the curtains here. We just had a lot to eat. So that's not a hidden message to like get comfortable, maybe down. I'm not going to send around a summary ChatGPT version of this later. So stay awake, please pay attention. I'm going to have Tina do it like Energizer halfway through. But I'm really excited because this panel is looking at the megatrends. What are those things that are affecting the next generations of humans on this planet that really anywhere you go in the world, they are being touched by these forces? We're talking about digital experiences, social media, how that's transforming what adolescence is, the expanding exposure to violence, whether that be community-based violence, gender-based violence. As we saw this morning, the number of children and adolescents affected by humanitarian disasters has only gone up. And then, of course, climate change as something that adolescents are experiencing, but also what is climate anxiety? How do adolescents cope with that? And how do they turn that actually into activism to improve the world around them? We also heard from a number of our sessions earlier this morning, increasing awareness around flexibility of understanding gender, really a person-centered approach to gender that is also being attacked and threatened, or how are adolescents responding to that? And then also changing workplace needs. Well, what is it like to be in an environment that is much more separated from individuals, more remote work, higher level of demand, lower level of compensation? How are adolescents around the world responding to these megatrends? So I'm very excited. We have 5 fantastic speakers here. You can get their full bios in the program, but I just want to get a sense of some of their incredible work, and then I'll turn it over and they'll be presenting each, and then we'll have a very engaging discussion, so don't fall asleep. So Johannes Throul will be our first speaker. He's an associate professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health. His research focuses on developing and evaluating digital interventions to address substance use and promote mental well-being using real-time data and user-centered design. After Johannes, we'll have Maria Cecilia Dedios. She is an assistant research professor in the Department of Mental Health at the Johns Hopkins Bloomberg School of Public Health. Cecilia's research examines how poverty, violence, and political conflict shape youth mental health using participatory methods, mixed methods, evaluation to co-develop community-based interventions. So we heard earlier about the importance of co-development, and I can say that Cecilia is a master of this and even brings in some very strong anthropology to that. Then someone I've known for quite a long time, and somebody who I've admired throughout her work, so really excited to hear an update on that. Theresa Betancourt is the Salem Professor in Global Practice at the Boston College School of Social Work and Director of the Research Program on Children and Adversity. Her work focuses on resilience and mental health among children and families affected by conflict and adversity, leading large-scale interventions with a lot of use of implementation science to expand programs in Rwanda. And just a quick mention for anybody interested in some good reading, she has a brand new book out, Shadows into Light, from Harvard University Press, which is a fantastic description of her work in more than 2 decades, following a lot of adolescents who were former combatants in Sierra Leone and how they've grown up, and some of them to actually be leaders in the community, leaders in the government to really transform that country. Sean Joe, who I had the pleasure of just meeting this morning, is the Benjamin E. Youngdahl Professor at Washington University in St. Louis. His research is nationally recognized for advancing understanding of suicide risk among Black Americans, especially related to social determinants and firearm access, and for shaping effective prevention strategies for Black boys and young men. And finally, we have Jennifer Uchendu. Jennifer is the founder of SustyVibes, a youth-focused sustainability organization based in Nigeria. Her work explores the links between climate change and mental health, leading advocacy and support initiatives that promote psychosocial resilience among young people across Africa. So you have an amazing group. I'm going to leave now, let them do all the work. Now, but let me pass it over to Johannes to begin our discussion.
Thank you so much. Thank you so much for that introduction. And thank you to the organizers for having me and for putting social media on the agenda here. I don't know, my slides should be up. I don't see them yet. Do I just click and they come?
Yeah.
That's magic. Here we are. All right. Great. So I'm going to kick us off here in the first 5-6 minutes talking about social media and health. Just to acknowledge funding here, we have a large team and collaborators around the world, specifically in Saudi Arabia and in the Netherlands for this work. So just to give you a brief background on social media and why do we care. Obviously, the use of social media can have all kinds of consequences for young people. Those can be negative and positive. On the positive side, I would say we have an ecosystem online now that allows people to connect with each other, which can be specifically helpful for conditions that are faced with high stigma, that can connect groups of people for mutual and social support, where anonymity is a real advantage. Again, specifically for stigmatized mental health conditions, and this opportunity and the potential for supportive online communities. And then at the same time, I do worry, as somebody who does a lot of digital and mobile health research, about what I call the dark side of technology, which in my perspective is grounded in problematic business models, the attention economy, and I'll talk a little bit more about that in a minute. Right, so what I would like to invite all of you to think about is social media at, I would say, different levels of analysis, where we talk and think about individual consequences like mental health impacts, social support, potential of addiction. Behavioral addictions have been a bigger and bigger topic over the last couple of decades, where previously we only focused on substances that have addictive potential. But now there's a recognition that the same can happen to behaviors, where you don't get that reinforcement because of a substance that you put into your body, but because of the reinforcement you get from interacting with technology. And then just frankly, this issue of time spent. You can only spend that time in your lifetime once. And if that time is spent hours and hours per day on social media, something else has to give, right? Even though the social media per se might not be extremely harmful, if you spend no more time exercising, if you spend no more time with people in real life, in individual contact and interaction, there could be negative consequences accruing just because of that, because social media is crowding out other activities. So on the societal level, I think there are plenty of consequences that we're starting to see, and I'm not going to go into that today, but in terms of the impact on our society and on our political system, in terms of floods of misinformation, echo chambers, and radicalization. Almost like a catalyst to issues that we are already facing in society. And then broadly speaking, I think I'm coming back to these market pressures of an industry business model and the attention economy, not unlike what we saw maybe in big tobacco decades and decades ago, where there were some first whistleblowers who brought data out of these companies that then researchers independently could investigate. And I think we're starting to see some of these things happening with whistleblowers in the social media companies, but it's still, it's very early. And the main problem that remains is these companies are sitting on mountains and mountains of data that independent investigators have no access to. So it is incredibly difficult for us to study the consequences of social media use. Frankly, also because the ecosystem is changing so quickly. The platform that was used yesterday might not be the platform that is used today, might not be the platform that is used tomorrow. And so when you think about it, just practically designing, say, a longitudinal study to look at the health consequences of a specific platform, you may not even be able to do that because in a year's time, everybody has moved on to something different. So those are the practical challenges in this space. The social media and research perspective is still a little bit of an open question, I would say. So this was an umbrella review, so a review of multiple reviews that have been done in the space that essentially says there's no consensus. There are only studies that show like summaries that combine the same studies but come to vastly different conclusions. And there could well be, I think this is an important take-home point, there could well be subgroups of individuals, young people that are impacted in a very negative way, and some maybe in a positive way, that are masked by population averages. And if we can't look at the specific subgroups, and if we can't look at the specific kind of ways in which social media are used, like I say, one example is active versus passive use, where passive use is you're just getting bombarded by content for hours at a time. Active use might be you actually have interactions with your friends, with your peers on the platforms and get social support. So those could be, the same amount of time spent on a social media platform with vastly different consequences. Right. So one of the main data sources that I think that help us right now to make a causal claim of social media impact mental health outcomes are these type of randomized trials and experiments that try to get people off of social media or reduce the time they spend and look at the health outcomes. Because in those types of studies, we can control all of the kind of confounders that otherwise are an issue in other study designs. And at this point, we also have a population that is pretty much like everybody is treated, right? So like you can't really do a randomized trial to start people using social media in different ways, for example. So the best way that we can control for this is to try and do interventions that get people off. And we did a reanalysis of a meta-analysis here, where we looked at the length of intervention, how long people abstained or reduced their social media time. And we found this curvy linear relationship with positive consequences on mental health outcomes for studies that did this abstinence or reduction for 1 week or longer. And again, the data are not like really robust here yet. There are a lot more studies that need to be done to improve the evidence base. But what we're seeing emerge here is kind of the sweet spot in studies that go for 2 or 3 weeks long. That essentially give people an opportunity to renegotiate their own relationship with technology and with these platforms. What I see the cutting edge topics right now is this issue of active versus passive use. We can look at positive versus negative interactions on these platforms, and then still trying to understand what the mechanisms are. I mentioned this trade-off of online versus offline time earlier. What is digital balance as technology use that impacts physical, mental, and social well-being all combined, right? Because technology really is in our lives in all of the different ways. And so it's really hard at some point to separate out an impact on one specific domain. And then I think there's a lot of more work that remains to be done on the intervention side. So abstinence versus moderation interventions, school-based interventions, the impact of phone policies. A lot of school systems are moving in that direction, and there will be really robust evaluation work needed to look at what these phone policies will do to mental health outcomes, for example. And then the longevity of effects, how long do these effects last? What we're working with this digital balance model that I mentioned. We see digital technology at the intersection of physical, mental, and social well-being. And on the measurement side of things, there are interesting new developments in what we call data donation, where individuals can donate their own data that the social media platforms have on them. So everybody can request their own data from, like, say, if you use Instagram, you can get literally like your every interaction, like how many likes you've put, how many messages you sent, like all of these things. And we can look at, as researchers, then that will help us get a little bit more of an insight into that black box of what does social media use exactly look like and what health outcomes can we connect to that. On the intervention side of things, I always like to talk about this on 3 different levels of analysis. Of course, it's important for all of us to, investigate and evaluate our own relationship to technology, and we can develop and deliver interventions that help young people change their technology use. But I think a lot of the scale, right, in public health, we think about population level impacts and scale. And I think a lot of the scale can come from social norms. So what are the social norms we accept? Like, is it acceptable to have a phone out on the table at dinner and get distracted by your technology rather than being present with other people around you that you have FaceTime with? And then on the macro level, obviously, if we want population level impact, we need to think about population level solutions, and those tend to be policies, those tend to be laws and regulations, and those also need to involve the industry as a key player and stakeholder at the table. And I will leave you with, we started talking about social media. I think what is currently the latest development is what's happening in large language models, where some of the very similar pressures on the industry exist, where we see that in the social media space, the social media companies are competing for a limited number of users with a limited attention span or time to spend. And so there is a lot of pressure for companies to make their platform more sticky than the competition, right? So people want to spend more time on their platform and not with the competition. I think we're starting to see some similar patterns emerge in large language models, where this is an example from ChatGPT 4.0 that had a lot of issues with making the models too reinforcing. And I think this is a sobering example of somebody sharing what I would consider an expression of serious mental illness. And the model essentially just reaffirms delusional thinking. And if that's where large language models are headed, then I think we're in for a rough ride. And so I will just leave that there for social media is still with us, but was yesterday. Currently, we're thinking a lot more about large language models. And so I just invite you to think about what some commonalities might be in the industry pressures that we see in social media, but are also coming through in the large language model space. Thank you.
And over to Cecilia.
This may be more of a conversation here. So thank you, Brandon, for the introduction, and hello, everyone. So most people are not directly affected by violence, but all of us are affected by its mental health consequences and its societal consequences. And I think this is particularly true for young people. So my talk today will be focusing on why we should all care about it. So violence is definitely a structural determinant of mental health. It affects young people directly. Seeing someone you love being victimized can cause PTSD, right? But also internal displacement is a major factor driving worsening mental health outcomes among refugees. It also affects different levels. It affects mental health for individuals, but it also affects communities and, importantly, societies at large. So something that is very important to consider when we think about violence is that violence is not destiny, although in some contexts it may feel like it, right? So bold policy can help us address its mental health consequences. We know, for instance, that greening spaces in Philadelphia successfully diminished urban violence, right? Evidence from Medellin in Colombia show how improving public transportation, connecting marginalized communities, alongside better public spaces, well-lit streets, can indeed decrease urban violence. So those are some of the examples of things we need to start thinking in regards to bold policy to manage violence. On the other hand, we can also use bold policies to manage the mental health consequences of violence. Refugees, ex-combatants, right, carry the weight of violence with them, definitely. But, and of course, clinical services and trauma-informed care is very, very important. However, we can also use policy to produce better opportunities for them as they integrate into their context. So work permits for refugees have proven to improve mental health outcomes, right? As are second opportunities for gang members, child soldiers, that I'm sure Theresa will be discussing in more length. So I guess the first message I would like us to consider is that bold policy is a way out of protracted violence. Second, I'd like to highlight a focus on social connectedness. And this is because I think violence affects our ability to connect with others, right? So violence affects community life in ways in which, for instance, I cannot trust my neighbors because I don't know who they are or what they think, right? In violent contexts, the other becomes a threat. So things like empathy or perspective taking really become very, very difficult, right? Intergroup conflict dynamics get entrenched, and that is true for gang dynamics, but also for polarized partisanship. And so in that context, open dialogue really becomes very, very difficult. So I think interventions that can focus on social reconnection as a foundation for mental health should be part of our curriculum. For instance, in a project that I co-led with colleagues, Rochelle Burgess and Solerio Shelovich, we try to co-develop mental health interventions, community-led mental health interventions with conflict-affected communities in Southern Colombia. And what we saw is that most of the actions proposed by these communities had to do with either generating social connections or deepening already existing social bonds, right? So, and I think this issue of social connectedness is particularly important for young people because they are undergoing a developmental stage where social bonds are fundamental for positive development. Other types of interventions, for instance, focused on forgiveness and reconciliation, have proven to be powerful tools to improve mental health outcomes among conflict-affected populations around the world. And lastly, I'd like to emphasize the need to focus on micro-contexts of development, because violence affects our ability to care for others. And by micro-contexts of development, I mean families, schools, communities, where violence tends to kind of like reproduce itself through relationships that are core for positive youth development. Caregivers, parents, teachers are themselves affected by violence, right? And also other young people in the community. So in this context, what we usually see is a layering up of different types of violence that's in the plural. So we see, gender-based violence, bullying, child abuse. So, and interventions that can target these contexts for development are very, very important. For parents, for instance, these may take the form of parenting skills interventions or parenting styles interventions, but these also may take the form of support for caregiving responsibilities, right? Releasing of stress, or straightforward poverty reduction strategies. Because if you want to see how a child is doing in a conflict-affected setting, you may want to check on the parents as well. And in these settings, parents are oftentimes struggling to make ends meet. In schools, for teachers, these may take the form of social-emotional learning or social-emotional skills training and conflict resolution skills, because then again, teachers are dealing with heightened levels of peer violence in the classroom. And then finally, for communities, it's important to support research and learning with communities, because communities hold valid local knowledge and very deep lived experience expertise that needs to be included in how we address and develop interventions to improve violence and its mental health consequences on young people.
Keep it going, just stay here and try it out.
It's a relaxing afternoon talk here.
And I like that. So let me see if I can actually get to my slides and then.
The other way.
Other way. Okay, let's try this. Yeah, all right. So I wanted to pick up on this theme in talking about violence and talk about war-affected settings, and especially the topic of life opportunities, and look at both opportunities to get back into education, but also work opportunities for young people. I'm motivated in doing this work because in our lifetimes, we are facing the largest humanitarian crisis since World War II. We're talking about 473 million children who live in active conflict zones. And I'm going to talk today about post-conflict Sierra Leone. I also work in post-conflict Rwanda. when you start to think of the numbers there, it swells even further. We're talking about, UNICEF estimates 125 million adolescents living in war zones around the world. And if you're interested in adversity and children, Sierra Leone, my beloved Sierra Leone, where I've worked for 23 years, offers far too many opportunities to study these sorts of topics. It's a nation of about 8.8 million people. In the 23 years I've worked there, it has been ranked at the bottom of the UN Human Development Index with a system of, the health system was destroyed by the war and never really rebuilt. It has some of the highest rates of maternal mortality on earth, infant mortality, and very low rates of literacy, especially facing young people. Sierra Leone, in addition to an 11-year civil war, had, you've seen the Ebola epidemic of 2014, 2015, that sort of was very much in the news. More recently, Mpox outbreak, and we've had climate change disasters that have killed thousands of people with heavy rains. And now we're experiencing, because of the failure to address mental health historically in Sierra Leone, a drug epidemic of a street drug called Kush, which is a cannabinoid mixed with synthetics that is causing massive addictions. So in the background of all this, my team and I, working with Caritas and the government of Sierra Leone, we've been doing a longitudinal study. At the end of the war, we enrolled a cohort of 529 young people. They were 10 to 17 at the end of the war. And we've been tracking their lives as they've become young adults and now as they become parents. So we've had 5 waves of data collection: 2002, 2004, 2008, 2016, and now we just finished our 5th wave. And we've been able to add indicators of stress biology, inflammatory markers, telomeres, but also start to look at those parent-child interactions when you have such a trauma history, and understand what is it that distinguishes someone who goes through experiences like that, including being abducted into armed forces and armed groups, and comes out to be a nurturing parent. What can we learn from that sort of ordinary resilience? At every step in our study, when we've had some time to distill data and understand what's leverageable here, we've developed interventions, and we've done mental health services research. And we know there's a bidirectional relationship between mental health and work, right? Having access to work usually can improve mental health, but you can't do a great job in the work environment if your mental health needs aren't addressed. And we see that there are a lot of barriers facing, especially young women, when it comes to the work environment and conflict-affected settings. But operating in adolescence is really important, because this is when risk of school dropout, teen pregnancy, addiction problems are all very high. And so we want to be focusing on youth. And so as we arrived at 3 waves of data with our longitudinal study of war, we started to see that, yes, there were some programs focused on PTSD, but there's been this discussion today about transdiagnostic thinking. I think, Shoshana, you did a really nice job talking about that there are certain cross-cutting problem areas that don't just hang out with one diagnosis. We see interpersonal challenges, we see emotion regulation challenges in kids who have depression, anxiety, traumatic stress reactions. Can we target those as we think about life opportunities? And we link these interventions to school programs and to jobs programs? And that was the genesis of what we call the youth readiness intervention. And we call it readiness because there was a lot of awareness around school readiness, but we're talking about readiness for adolescents, right? To get back into work, to get back into school settings. And so we reviewed the literature. We took 6 common practice elements that have been used in a lot of interventions for violence-affected young people. And we needed to have it be able to be delivered by non-specialists, because Sierra Leone at the time had 1 psychiatrist, a handful of PhD folks, and people going back and forth. So we'd have to think of task sharing, task shifting, which I think is a really important topic when we talk about global mental health. And it would have to be not standalone mental health. You'd have to link it to the life opportunity. So this is our first trial of the readiness intervention in schools. And we either randomize kids to go right back to a school opportunity because they'd missed school because of the war, or they got the readiness intervention and then went to school. And as you might imagine, yes, it improved their interpersonal skills, it improved their daily functioning, it improved distress, it improved social support, but also the kids who got the readiness intervention were 6 times more likely to persist in school. And teachers who didn't know who was in which group, there was an effect at the teacher reports level for those who got the intervention. So then we said, all right, so if this works in a school setting, what about a work setting? What about livelihoods programs? Because a lot of youth have missed too much education. They just want to go right into livelihoods training. And Sierra Leone and the Ministry of Youth were doing an entrepreneurship program with the German development agency GIZ. And this was a part of the Global Mental Health Scale-Up Hubs. Pamela Collins was such a big part of getting this off the ground. We were honored to have the hub for Sierra Leone and Liberia. And we found when you screened young people applying to jobs programs, about 40% of them would meet criteria for elevated distress and impairment. And so what the innovation here was, can we train these youth employment and entrepreneurship workers to do the readiness intervention? Can they learn to do evidence-based mental health interventions if we attend to the issues of quality? And I think that came up earlier too. As we're doing task shifting, task sharing, and you talked about burnout with the youth panel, we also want to think, how do we support those frontline workers and make sure that they're getting the supervision and on-the-job training and support in their professional pathways for them too? And so when we did this enrolled over 1,000 youth. We had cross-site learning across 3 districts. We had plan, do, study, act cycles. We're really starting to use the tools of implementation science now and say we're testing at the same time effectiveness, but also a strategy that we call the collaborative team approach for improving quality as we go. And Jordan Freeman, who's here, where's Jordan Freeman? Is the first author here. Good job, Jordan, on this paper. Her amazing hybrid type 2 effectiveness implementation study, where we found when we integrated this evidence-based group mental health intervention into the entrepreneurship program, yes, it improved anxiety and depression when you had the combination of readiness and entrepreneurship. But also we had a community effect, that community leaders noticed that these youth were also much more engaged in a positive way in their community. And we saw also at the economic level some returns. That yes, young people were making more money, they were moving towards entrepreneurship, and the effect was even stronger in young women, which is really exciting given the barriers young women face. This was a very feasible and acceptable platform for getting mental health out there. And that's exciting because you think when you come to places like this where you've had a lot of devastation and systems are weak, we can use the school system, use the entrepreneurship and the jobs programs to get evidence-based mental health out there. We are seeing effects 4 years later on anxiety and depression. Not yet published, Jordan, as you know, but we'll get there. So I don't have a lot of time. We'll move to the discussion, but I hope I've been able to underscore the importance of using longitudinal data, especially when youth face violence, to draw out those mechanisms that are modifiable. And that the big era ahead of us is the era of science of scale. There are methods, there's rigor, there are journals, there are frameworks. We need to bring all of those tools to bear on how we study these innovations of integrating evidence-based mental health interventions into other delivery platforms and find out what works for whom under what circumstances so that we can truly strengthen health systems. I'm from a rural part of Alaska, and I guess another big inspiration for me in working in Sierra Leone with the partners we do is if you can innovate in places like Sierra Leone and do this, you can do it anywhere. You can bring it to the remote parts of Alaska where I'm from. And so it's just an honor, and it's an honor to be with all of you. And I'll give you a shameless plug for my book if you ever want to read about 23 years of research on war affected youth. And I'll be coming to watch you to give a talk soon. Yeah, looking forward to that. All right.
And over to Sean. Sean, I'm gonna give you this, just do this left.
Oh, no slides, no slides, no
Right.
slides. No, no slides. I just had to take a gamble. It's between leave the cookie or eat the cookie. And I ate the cookie, so I have to stay. So my cookie went out, and I was like, no, I can't do it from there. I gotta stand up. Well, I want to thank you all, those who invited us to be here, including myself. What a powerful set of conversations that we're having. I had 2 major points I wanted to bring to us, but first I wanted to introduce myself a little bit. So as I sit here, I stand here, you have an understanding of who I am. The work that we do is around Black boys and young men. And like you're working in different communities where they have a lot of resources or they don't. It's hard work. And many of you have been doing it for many years. And for those who are new, you're beginning to take the mantle. So I'm going to bring up the analogy of who is more committed to an egg and bacon breakfast? Who's more committed? And I'm going to cut to it real quickly because we don't have a lot of time. Is it the chicken or the pig? Who's more committed to that breakfast? How many people say the chicken? All right. How many people say the pig? Now, for the short of it, for those who are thinking chicken, it's not the chicken because the pig has to die to create that breakfast. So we use that as an analogy between involvement versus commitment. And some work requires commitment. That means you want to push things to be at scale, and you want to be in a situation where you don't want to see another generation of scholars or practitioners come back to do the same thing at the same level because you've seen it over and over again. It's like investing lots of millions of dollars and nothing changed around those neighborhoods. So that's the idea. So that's what the type of person who I think I am. I think, I am definitely a pig. So if you never aspire to be a pig, I'm encouraging you to think about that. But let me get to my point. So what I wanted to lift up here, because my work is generally on suicide and the mental health consequences that males face in society. And I want to build on what my colleagues have presented already to push the conversation a little bit. So here's what I'm hoping that you will get if I don't make the point, but I want to state the point. So we're in a moment that we have to change our gaze. So some of us, we're looking at things as they are right now, and some of us need to look at things at where they're going to be in 50 years. So I'm pushing a 50-year gaze because we're at a turning point in global society that happened at the turn of the 20th century. And that is, we're going to have to now redefine the adolescent period. What does it mean and what do you do with adolescence? And what I'm lifting up here is that what happens in society when AI and technology really shifts, right, the role of work in society. When it was an agrarian society and technology came about, we had to shift. So more and more people went into public schools. That was created as a result of we needed less people on farms and doing that sort of work when the society and the industry and economy changed. We're in the same space with AI and technology. So my work is definitely around males. And one of the things that males face is this social strain around what is their role as providers. And when we have large number of males, which is growing in the US and globally, who are disconnected, the concern is what's happened to isolated male, disconnected males, males without purpose. There are a few things that result from that. A lot of that is going to be social disorder. Any large group of prime age working males not engaged and disconnected are going to turn on others and turn on themselves. And there's a lot of books and we can cite studies around those sort of things. But that's the question. So I'm calling into question as a mega trend that we have to pay attention now to what's happening to the role of work. That calls into question the idea that we're now at the phase that that role of work is changing. AI is scheduled to impact 300 million jobs, and in OECD countries, 20% of those jobs will be impacted. And we have to begin to think that now we're in a strange new paradox for our age, and we're going to have to say, well, what is this adolescent period? And what are we going to do with it? Because if we don't plan for it, what tends to happen is that you see a large growth in the absence of empathy. And if you're not paying attention to the leadership that's leading the world right now, not too far from here, I can say these things, you're seeing the idea that empathy is waning. And when you have empathy waning and then you have guilt waning, that people don't have a sense of guilt for whatever is done, particularly among males, that's a deep emotional concern. So now when you have males who are feeling disconnected, who are feeling they don't have that role, then they're feeling that no one is really paying attention to their role, they can get involved with lots of things like crime, violence, war, because they're trying to find meaning and purpose now that their idea of what work has changed. So I want to lift that up to say that's one of the gaze I'm most concerned about for young people globally, the changing nature of work. When we don't need that much human capital to produce the same level of economies that we're having. And all countries are struggling with this. It started in Germany when they started to struggle with it and they were having fewer children. We're now going to see these things play out. These mega trends are going to have an impact and it'll show up in the work that you do, whether it's resulting from the war that would create refugees, whether it's resulting from scarce investment in new roles for human capital. I don't have the answer, but I know this is one of the major questions that we have to look at. So we're experiencing that turn of the century, and it's going to be an economic shock to different countries. We're all at different phases and stages of this change, whether it's in the US or in Guyana or it's in Uganda. We're at different phases and stages of this change. So, and I want to bring your attention to that. So I'll leave you with a few questions. Work impacts males' mental health, right? This economic upheaval hits them hard. It hits their self-esteem. It's closely tied to their sense of usefulness. When they think about their role as providers, the data makes this painfully clear. We know men are 4 times likely to die from suicide, and depends on your country, it's even higher. And if you look at different subgroups, like with Black Americans, it's 6 to 8 times more likely to die. When again, they're trying to find out what to do with the pain of lack of purposefulness. I had a wonderful quote that I was going to put up. I said, no, of Frederick Douglass. And he talks about when men don't have, or anyone don't have that sense of usefulness and purposefulness in the society, what tends to happen to them. And it's a very emotionally scarring experience. So globally and locally, when this doesn't happen, our boys are twice as likely as girls to be diagnosed with behavioral problems, not because they're acting out more, but because their emotional struggles often manifest as aggression and defiance. And globally and locally, here's what tends to happen to males. They will begin to get, they will get increase in being disciplined, being detained, being deployed, if it's war, right? And disregarded rather than helped and invested in. So as you think about this, this leads to a level of silence. And if a young man is told that his worth depends on being self-sufficient provider, what language does he have left to describe himself when technology takes over his job? So the path ahead requires us to separate human dignity from economic usefulness. And technology and AI can do the work, then what's left for us are things like love, care, creativity, and connection. So I'm lifting up the idea of potential crisis of empathy and emotional intelligence, and the importance of creative thinking and ethical judgment might be what's left when you don't need people for certain levels of economy. And if AI promises or technology promises to comfort us and make work no longer part of what defines us, what will we spend our time doing? And particularly during the adolescent phase.
Thank you so much, Sean. Jennifer, you're gonna sit down, stand up. Did you have a cookie? Not have a cookie?
I did not have a cookie, but everyone else has 20+ experience. I'm like, I'm just gonna stand.
Are you saying we can't stand up?
Thank you, everyone, and it's such a pleasure to be here. I bring in the youth voice and dimension to this conversation, but more importantly, we're talking about megatrends and all of this incredible urgent work that you do. The climate crisis is an additional, and we often say that climate change changes everything. So it makes everything that you've all spoken about even worse. It's that amplifier. I have come into this work as an environmentalist, a climate activist, passionate about protecting the environment, and then kind of hit with the mental health side of things, that we're worried about all of the work that we've been doing just going nowhere. So it's that sense of hopelessness and powerlessness. And I'll speak to it a bit. So the work that I do at SustyVibes, I've been running for the past 9 years. And we're essentially a community of young people passionate about protecting the environment. But about 5 years down the line, through the work that we did, a lot of the young people within our community said, we're stressed, we're overwhelmed, and we're scared. We're scared because planting 1,000,001 trees is still not doing the job. Because when we look at the West, when we look at the power holders, we're still not prioritizing the issue. So what exactly is the fix? What does climate action look like, particularly for young people? And so I started another initiative within SustyVibes called the Eco-Anxiety Africa Project. And for us, it was really important to understand what is the dimension of the climate crisis intersected with mental health issues for us in Africa. Now, remember that Africa contributed less than 4% of global emissions. However, in Sierra Leone, as it was just mentioned, there are landslides and multiple deaths. In Nigeria, we have flooding, we have multiple, climate disasters. So we are feeling the brunt of the issue, even though we contributed less. So there is an injustice dimension that also kind of worsens our mental health as well. But more particularly, it's the idea that these emotions are complex, right? It's not just about the climate crisis in and of itself, but it's that at the backdrop of all of this, we also have to grapple with socioeconomic issues. We have to grapple with what does the future look like in Africa? We don't have money, we don't have that kind of ability and privilege to dream. And that's the reality, unfortunately. We also need to understand particularly, how do we promote local research? So, for example, when I go on Google Scholar and any of these big searches to look for climate and mental health, I rarely would find anything from Africa, even though we've been experiencing these issues for generations. So that is the ironic reality that we have to deal with. And all of these things come together to impact our mental health and our well-being in one way or the other. So when we started the Eco-Anxiety Africa project, one of the first things we did was to put out a survey asking young people in Nigeria what exactly are some of the contributors to mental health issues. And it was interesting that climate events, and we talk about climate events, not just as floods and environmental manifestations, but what that really looks like, the lack of jobs, and how that infrastructure, the lack of it, comes into what we call our bread and butter, how we earn, how we're able to make life for ourselves. And the climate events took, I think it was over 30% of what young people were facing. And so we realized that this is a big issue, but we didn't have a name for it. And so the Eco-Anxiety Africa project wanted to name and validate this issue. And so oftentimes when I talk about eco-anxiety in Africa, they're like, what do you mean? That sounds like white people's problem. But then I explain it and they're like, oh my God, yes, this is definitely what we've been experiencing. This is why we're activists. Every time we go to a COP30, it's because of this dimension, because when we talk about climate adaptation, we're struggling to cope. It's the reality of this issue back home that is the driving force. So eco-anxiety have actually long been with us before there was a name to call it, before it was validated. And that's something essential that we've been able to bring out. And so we've been working through community action, because it's important to still, run actions, whether it's tree planting, whether it's advocacy, and that's what helps us stay hopeful. But importantly, space making. And by space making, we're bringing young people together to discuss these issues. How does the climate crisis, how do emerging environmental issues, biodiversity loss, plastic pollution, how do all of these things intersect and impact your well-being? And then research. I often tell people that I've become an accidental researcher. I didn't sign up for this, basically, and I'm having to do an MPH, applying for doctorates, because I want to learn more about how to do this research, because our people need to tell our stories. And so the work that we've done have kind of expanded to this. And so what are we learning? Is that the environmental stressors that we see when we talk about climate change and the heat waves and the floods, biodiversity loss, deforestation, pollution, and natural disasters, and all of these things are impacting our well-being and our sense of what it means to actually thrive as a young person, more so in Africa. And I don't know if it's clear enough, but I've posted the climate emotions wheel. We zoom into the wheel, we see multiple emotions. And I know it's been highlighted earlier, the distress versus disorder. For us, we say it's impacting our well-being. And what that means is that our mental health further down the line will have an impact if there isn't any solution. And so if you look at the wheel, there are kind of multiple expressions of what this distress can look like. More importantly, there's emotions like anger. Hunger in the Niger Delta, for example, because of years of exploitation. There are places in, Nigeria, for example, that are deemed inhabitable because of pollution. So you find young people in those areas extremely angry and outraged, and they get into violence, they get into drug addiction, and it's almost like a cycle. So these mega trends are obviously intersected, but in ways that we often exclude the climate crisis from and refuse to, get people who are responsible for these issues to, be informed. There's also the dimension around sadness, around grief, around guilt. So a lot of the work that I did earlier in research was working with youth climate activists in Brighton, and they talked about the guilt they felt because of their ancestral identities and privilege. And they said it's difficult to sort of dissociate themselves as young white people, knowing fully well that the climate crisis is entrenched in colonial histories of extraction. And so that's a reality, and that's also impacting young people's mental health. While I can't relate with that guilt because I'm Black and I'm African, I still recognize that and I can empathize with that. But also there's some positives. The positives that this realization is also bringing us together. It's also making us more interested, and it's also bringing a sense of hope. When we come together, for example, through our shared emotions and work together, and what does solidarity then look like when mental health professionals, climate activists are coming together in a room and saying, well, we need to support young people, and to do that, we need to promote climate action. Essentially, this work is important because children and young people are more likely to worry about environmental stressors. We're constantly talking about and thinking about our future. I grew up, for example, being told I was the future, I was the hope of the world, I'll change, I'll solve climate change. And I often ask how. I have no money, I don't make any power, I don't make any decision. And so in literature, it's called the burden of hope, and a sense of moral injury that's being placed on young people all over the world, particularly climate activists, being told they need to continue coming forth and doing all of this work. But as we heard from the earlier panel, we're burnt out, and this is not realistic because we know that climate action really lies in power holders and the people who can make decisions to change things. It's also really important to look at how young people are more vulnerable to diseases. When we look at that intersection between climate change and health, floods and cholera, malaria and whatnot, Zika, and we see that there's a burden on young people and women that really needs to be looked at. And also, something that I wanted to point out is that the concept of environment is not just trees and snows and mountains. For us in Africa, it's our future, it's where we live, it's our context. So when we talk about the environment, it's literally how are we surviving? Is the environment safe enough? Can we thrive? And can we actually live here? And for us, the answer is often no or not really. And also there are direct and indirect stressors. So if I'm not impacted by flooding, I might read something on social media that triggers me. And so we see a lot of worry, a lot of climate anxiety, even just coming from that exposure. People see the impact of the climate crisis in other areas, and it has an impact on their mental health as well. And then finally, I talked about the positives. This can also unite us. Two projects I wanted to point out is the Connecting Climate Minds project. I was very fortunate to work on this. It was a Wellcome Trust-funded project, and we wanted to sort of catalyze climate and mental health research and say what are the most important issues and what are the things that really we should think of when we talk about youths in this sector. So the populations of interest for us had to be girls. We have young women, girls who have decided, for example, not to have children as a result of the climate crisis. This is an issue that needs to be talked about, that needs to be addressed. We also have young people who have existing mental health issues, now kind of adding the climate crisis on top of that. So it's like that dual burden that needs to be also looked at.
people who are from poor backgrounds, who have difficulties to dream and imagine a life, who would be refugees, for example, who would be displaced by floods or climate disasters. These are the people that research around climate and mental health needs to look at. And then when we look at our research teams, there are lots of conversations from young people all over the world that we spoke to about this sense of uncertainty. I don't know what my life would look like in 10 years. I don't know what it will look like in 15 years. So it's difficult to dream, it's difficult to hope. A sense of identity as well, particularly if you come from, a population of fisher people or farmers. These climate issues are literally the things you deal with every day, and your sense of identity is sort of eroded by these disasters. Vulnerability was a big one. Government inaction, and almost ironic to speak about it here in the US, where we're seeing that sort of irony of government inaction when we talk about climate change and mental health. Then, of course, the psychological impact. What does this look like further down the line for young people who are currently dealing with climate anxiety? If those people, for example, get into jobs where they have to decide, what are they going to do? And we've said, looking at what that trends could look like, what would the future of climate and dream jobs look like when we have multiple young people feeling this great sense of despair and feeling kind of disconnected from the issue? And so with the Connecting Climate Mind project, we saw that anxiety, suicidal ideation, stress, post-traumatic stress disorder, but also pre-traumatic, because people are scared and anticipating what will happen. And that's also a big issue for us to deal with. And the second one is the Zen Guardians project. And this is something we did at our own organization, working with the Youth Climate Justice Fund and the Rockefeller Foundation. And for us, it was really kind of what the earlier youth panel spoke about. How do we move from sort of including young people in conversation and sharing power and saying, this is your project, do what you feel is most important. And so we decided that with this funding, we're going to have mindful climate leadership. So when you talk about a climate leadership program, for example, where we're talking about breathwork, meditation, what exactly is most important? How do you show up as a climate leader and a young person? These are the things that are most important to us. We also wanted to provide funding directly to the young people and say to them, you have X amount of money, what projects does your community need? How do you pay yourself and compensate yourself? How can you feel good and validated in this work that you do? And this for us was a good example of what it looks like when we move away from the traditional climate action project and really involve youth and have it mindful and grounded in our realities, so that we move from the sense of despair to more hopeful and that sense of agency and empowerment, basically. And so in summary, I've talked about the climate stressors, climate change impacting our mental health in intersecting ways, whether it's reproductive health, whether it's our sense of identity. There's just multiple intersections that come in. And then young people need to be involved, but not in a tokenist way, in ways that where shared power is evident, where they are compensated for their ideas and they're seen as experts in their own right. Because as an older person, frankly, you don't know what a young person is feeling until they tell you that, right? So it makes them the expert of their own life. And then more importantly is that certain young people and groups who feel this impact more acutely, and we need to acknowledge that and stand in solidarity with them. And then that government inaction, towards environmental issue, it's a leading trigger, and there's lots of research to back that. When constantly young people are seeing that their governments are not prioritizing this issue, it's a sense of climate anxiety. It's the leading cause of climate anxiety in a lot of them. And for us, we think this is important to highlight. In literature, it's often called this idea of eco-gaslighting, because before elections, we get to hear a lot of things. This will be done, that will be done. But further down the line, we see that there's a lack of prioritization. And so that is a big trigger for climate anxiety. And then finally, mental health professionals urgently need to respond to this emerging public health issue. by responding, I think it's beyond research and conferences and conversation. It's also taking efforts towards climate action, supporting the young people in your community, doing the work, within communities on climate action, showing us that there's an all hands on deck approach towards this, that this is not a crisis for some people, for environmentalists and climate activists to deal with, but this is our problem, and this is how we can all come together to work. Thank you.
So much, Jennifer, and thank you so much to all the panelists. So we'll take a moment and have some questions amongst ourselves, and then open it up to you all to have some discussion about these megatrends and what we do about them. I just wanted to start out and actually pose a question to all of you. If we think about, there was the first commission on adolescent health, we've got now the second commission. So take this out to 2035, and we have the third commission, which will be led by the youth leaders of the current one. They'll no longer be able to call themselves youth. But if we think to the 2035 commission and we're reading through it, what do you think would be those key aspects of we made the right decision in doing this at this time? That it would be those examples where we found something that worked, or we stopped doing something that was problematic. But what do you think, looking back 10 years from now, we would say that that was a good decision, that was a key act, that was something that had to be done? And that could be something very small, very specific that you're like, we just need to do this next, or blue sky, very, very open, imaginative thinking. But yeah, feel free to take it in any order. But what do you think when we look back 10 years from now? We'll say those were the right decisions, or those were the things that we stopped doing, that we needed to stop doing. Anyone want to go first?
All right. Well, so on the technology side, the social media side of things, I would say policymakers are in a profoundly difficult situation when we, for quite a while, I think we won't have definitive data to say, this is clearly the causal agent, this is clearly what you have to do, and here's the one intervention that will solve all of your problems. And so they are in a bind in terms of having to make decisions before a backdrop of profound uncertainty. And yet they don't have the luxury to wait. And so what we're seeing right now, and this is another parallel, I briefly mentioned this in my presentation, where there is, I will say on the industry side of things, there is a benefit to highlighting that there's the doubt and that we don't know and we can't really make decisions until we know for certain, let's say, what the social media doing to a young person's mental health. And in the absence of knowing, better not do anything and just wait, because it works for the business model. They can keep making money, they keep doing business as usual. That's what the tobacco industry did for the longest time. And so what we see and what we saw in tobacco is that there was very little regulation coming from the federal government, but it started locally. It started in local communities. It scaled to larger communities. It scaled to states. And that's where a lot of the regulatory action started happening. And I think right now we're in a moment where we're seeing similar things happen, where states are making policy, where local school districts are starting to make policy. And that's where we will see a lot of the, I think, hopefully beneficial outcomes of these policies. Like, I mean, what do smartphones have to do in classrooms? Like literally, like who needs a smartphone on their desk when they're like in school and should be paying attention to the teacher? And so I think if 10 years from now, if we look back, I think we will be pleased to look back and say those were the policy decisions that were being made. At the very least, we will get variation. From a research perspective, we will get different interventions implemented that we can look at the outcomes of. Because in absence of doing anything, we won't know for a long time. And at least now some things are starting to happen where we can see, okay, this is working, this might not be working, and then we can improve and make these interventions better moving forward. But if we just wait and do nothing, then we will in 10 years, we will be none the wiser.
So basically what you're saying is when my adolescent children are asking for phones, I'll say, in 10 years, when I said to you, you couldn't have the phone, you look back and say, Johannes was right. You did not need a smartphone. Great. Other thoughts? I'll blame it on you. Yes.
Well, I'm gonna push, the idea that we have to pay attention as we're looking at health and well-being, how societies are structured and what are kind of very functional science, because everything fits into that. Things are being reorganized, so hopefully we're starting to think at population level interventions and work, because it's multi-sectorial, but it's really helping to collaborate or co-create, not only with young people, but you got to have business and community to say, how is the society functioning? We're at that space that if we don't figure it out, it will be figured out in very maladaptive ways. So I'm really worried about that. So the idea of scaling becomes critically important. And not just to go up to population level thinking, because you have to have the population level infrastructure to do population level work and those sort of things. And we can have demonstrations in different countries at scale that we can refer to of what work, what didn't work, what technology, all these different things. But if we have a few examples of what's working at scale, and that scale also means you're drilling down, because there's a level of fidelity that you have to implement a population level strategy. It's not just go big, but all the small things have to work. Processes, funding, training, and making sure people are adhering to the fidelity of the design. So I'm hoping that I do some of that in 2035.
Great, thank you. Yeah, I was going to say, Theresa probably is going to jump right on top of that.
I really like what you're saying about having it be transformative and thinking about scale. And I would just put in, if we look back, 10 years from now, I would hope that we are intentional about scale, because there's a lot of talk about it, but I think we're getting too far away from some of the science of it. There's a field of implementation science. There's a literature, there's journals. And when I look at war-affected settings and I think about Sierra Leone, what I never want to see again, and I'm looking at what could happen in Gaza, I'm looking at Ukraine, I'm watching what's continuing in Sudan. What normally has happened with mental health is once there's some sort of a peace agreement, then, okay, let's get the power grid back up and let's make the roads and maybe let's open some schools. And then 20 years later, they say, oh, mental health. Well, these kids have all these problems. I wonder what explains that. And then it becomes like a second tier. It can never again be that way. It needs to be part and parcel of the rebuilding, and you need to start planning in the now, not waiting even for the peace process. And I have been thinking of what are successful examples. And I've been honored to be a part of the U.S. National Child Traumatic Stress Network. Does anyone know about the NCTSN? If you don't, please Google it. Amazing. 20 years ago, a bunch of clinicians and researchers saying, look, we've got all these trauma-informed or trauma-focused mental health interventions. We have all these forms of trauma facing kids, but we're not getting these interventions out there in common use. And it moved from 17 sites to now 220 sites through intentional implementation science, testing of the strategies for scale, testing of the strategies for quality improvement. So for intentional, we can do it. Look what the Global Fund has done for HIV and AIDS, tuberculosis, malaria. We've got other models of global health that have done it. If we have some sort of merging of these two things, looking at what's worked and being intentional, I think we can be transformative. Yeah.
So something I really like in this report is inclusion of youth voices. I really see a picking up of the inclusion of different perspectives. And I think that's the right way to go. I'd like going forward, I'd like to see more inclusion of local systems of knowledge. I think the dialogue is very important. And of course, this is kind of like a broad debate of epistemic justice, but at the more and that debate is by all means not solved, and it's important. But at the more practical level, I think the value of local systems of knowledge or diverse perspectives is that it makes our blind spots so clear. Like when you're trying, in the case of conflict-affected communities, if you're trying to produce effective interventions, but you lack that deep lived experience expertise, you risk importing things that won't last and won't work in context. So I'd like to see more of that in the future. But thinking of young people affected by violence, I think there's another layer and another challenge there in how we as researchers think about violence affected people. So they're usually people who have been victimized, they may have PTSD, trauma. There's plenty of evidence of how violence affects development, so moral development, self-regulation, so all these things that are completely real. That's not the entire story, the whole story. So it's also very important that we can capture the resilience, the strength, and the creativity of these young people in how we inform the interventions we deploy on the ground. And in that sense, I think on our side as researchers, it's a bit like building up on the previous panel. It's not an easy exercise. Just as an example, the STARSY project that I mentioned before, it was an participatory action research. And we found ourselves in this situation where, for instance, we were discussing with ex-combatants how PTSD is a politicized diagnosis, right? So it's used, or they feel institutions use the diagnosis to disqualify their views. So, but we are in a position where we have a funder that wants research on post-conflict settings where you need to include that outcome. So it's kind of like this negotiation of how do you navigate those disagreements and how do you successfully pull something together that makes sense for all partners involved and respects differences. I think that bit needs to kind of like continue growing because I think it's very, very important.
Okay, thank you. Jennifer.
Okay, I could just add on to say, 10 years from now, it would be great if we all, and by all I mean everyone in this room and working on these issues, became planetary health proponents. And what do I mean by that? Is that we're not separating these issues anymore to say the climate issue, mental health issue. We're bringing them together because they're all intersected. We won't talk about wars if we don't look at resource wars, and all of that toggle. We won't talk about displacement and refugees when we look at climate crisis. So that sense of ordering needs to be stopped, and we need to start merging these issues together. And then to be a proponent means we start saying no to fossil fuel money. We start being activists to issues that are promoting climate change in different areas. And we start looking critically at how the different pieces of our work has to do with the environment and what that means for well-being and mental health a few years down the line. Thank you.
Thank you. Well, I'd like to open it up to you all. Are there questions that you have for your co-panelists, things that triggered some new ideas or that you want to know more about? This is your time for Q&A amongst yourselves. And if you want to just sit back and be in awe, that's also totally acceptable.
Well, I never heard about AI for the digital folks. I think AI has a lot of potential, but it's also a lot of pitfalls, right? And I've been thinking about intervention development, mental health services, intervention development with young people. And usually young people are much better. They've been, learning these tools way more than researchers like myself. But have you seen good examples of like harnessing the capacity of AI? I'm thinking of some of our cross-cultural work where we try to get at local syndrome terms, acceptable ways to interview. We also work on refugees resettled in the United States. We have a project with Afghans. And we're finding that when it comes to questions about like substance use or sexual behaviors, a face-to-face interview, already it's really hard, even if the person's of the same culture, same language. Are there opportunities now with AI to create avatars, have like iPad delivered data collection, have youth co-create that? And do you know people doing that? What can that look like? Co-creation with youth and leaning into some of the good of AI, recognizing that it's not a silver bullet.
Yeah, I think, as you said, there's tremendous potential for all of that. And I use AI pretty much now in like literally every project I do. And we think about like the potential to have almost like your therapist in the pocket who can learn from your input. Like say if it's I don't know, I frequently use an example of like a sleep intervention. If I have a wearable that tracks my sleep, and then if the system gives me a recommendation of how to improve and then takes this data that I literally already produce to take that into a feedback loop and improve the recommendations it gives me over time based on the outcomes that it objectively observes, right? I think there's a tremendous potential there. And on the mental health side of things, I would say the off-the-shelf products of the companies are incredibly powerful, but I think there is a lack of guardrails right now, and there is a lack of having the mental health domain expertise like embedded in the companies. I think right now my sense is that the ethos and the social norms is still, we have something new, we'll ship it, and then we'll care about the consequences later. And for mental health, I worry, like especially the impact on vulnerable minds, I worry that that is not the way to go.
Any questions? If not, I'll open it up to you all. Please feel free to use one of the microphones. And please introduce yourself when you had a question. Thank you. Start over here.
Yes, thanks and congratulations to all the panelists. I was actually impacted by the words of Dr. Joe, mainly because he was able to convey the anguish of the times. We are currently facing a multiplicity of crises that are coming together, and I appreciate how societies are organized and they function, and certainly that has tremendous impact on the individual and collective well-being. But as part of that context, I think that the traditional way of dealing with the consequences of social dysfunction, behavioral problems, violence, has been the criminalization of mental distress and mental disorders. So the question is how to adopt some sort of new paradigms that will prevent the criminalization of mental distress. And once in prisons, if a person is in prison, you can create mechanisms to rehabilitate and prevent the common recidivism that one observes once a prisoner is discharged, mainly because the prisons, as structured now, are places of punishment rather than places of rehabilitation. Thanks.
So I'll deal with the latter first. Prisons, particularly the ones I'm exposed to, and jails, and in-school detention, it's not about growth.
Mm-hmm.
They're just now, we're accepting the will that they're about punishment. And then you put people out who well prepared to cause more harm. So let me just say that. But the bigger question, and I appreciate you asking that, is like, when I think about my work is with, again, Black boys, so instead of dealing with just suicide, I'm dealing with the broader outcomes, the positive outcomes that we want. So that made me shift to these sort of ideas. So for example, now we have to rethink about schools in St. Louis. Parents are choosing not to put their kids in certain public schools because of the psychological harm and also the developmental harm that they're going into. And it's not just public schools, so I don't want to get into that. But the point is the changing nature of why do we have K-12 education? Because parents have to work. They don't need that much time to teach those kids that same content. I talk to a lot of teachers. They're like, we don't need K-12 years. We can do that in 6 years. But we functionally, as society, because I know my daughter's being watched by someone right now and I go to work. It's just how we structure it. So I use that as the practical example. I'm dealing with things around preventing suicide by having to deal with how the society functions and the role that we have for these young people. So that means I have to rethink and say, how do I rethink with my community to co-create? What does that mean for St. Louis? That means we're thinking at scale. So, but then the other interventions work, whether you're in the jails and you're doing technologically based therapy or regular talk therapy and medication. Those things are gonna work, and we need experts to keep pushing that. But you can't do this in a vacuum. And I know we're acknowledging this, but part of our goal is to do that level of scale of community level science. To make sure that we understand what we're choosing and how best to choose around some of these issues. So we can start practically as we're thinking about the broader visioning of what we have to do and our role as scholars or practitioners or agencies in that context.
Thank you. A question over here.
Yes, hello. I'm back. I'm Cosmos, in case y'all forgot who I was. Okay, I have two questions for y'all, but first, I just want to thank this panel up here, because I feel like you guys do a really great job of showing the interconnectivity of everything. Because like I mentioned earlier, I feel like mental health should be positioned and viewed more as well-being than just strictly mental health, especially because of all the different factors that affect mental health altogether. Because at the end of the day, I feel like mental health is just another aspect of taking care of yourself. And as individuals, as people, we're already interconnected people altogether. With intersectionality of us. So it is a disservice to view mental health as just one single thing. So I'm very appreciative of this panel having all the different industries in the right word, all the different specialities, I should say. So thank you for that. My two questions is, do you think the research, I'm sorry, I'm bad names, I'm getting better at names, but the individuals that were speaking on war-affected youth, do you think there is a correlation between your research and your study specifically in like the areas that you was in to like high crime ridden areas in like the States? Even though that they're different, I feel like I don't know. Yeah, I thought there's similarities between the two. So do you think through your research specifically in that field, it can translate into a better understanding of how to tackle crime here in the States? Question number one. Oh, that's my second question?
Yeah.
Okay, my second question is to kind of answer the gentleman up this question with the nice bow tie. You had posed a question about, was it you? Someone up there posed a question about, it definitely was with the bow tie. I'm sorry. You had mentioned how adult males, one of the problems is when there is a lack of work, there's a lack of identity amongst males. So my answer / question to you is, do you think investing in art could be an avenue to help reshape people's identity, since for so long, I feel like in modern-esque human society, we associate ourselves with work, and an alternative could be with art. Because prior to, I guess, modern society, there was a lot more art involved in the world and our everyday lives. And that could be, for example, how we design literally anything, like a light post in Victorian era is very different from the light post created today. Those are my two questions. Thank you.
Thank you.
I'll try to talk a little bit about this topic of reciprocal innovation, which I think is really exciting. As I mentioned, I'm from like the indigenous Yupik part of Alaska, where you just saw those evacuations because of climate change. Bethel, my hometown, they were, taking people from the smaller villages because of the flooding. And I think all the time about the stuff we're doing in Sierra Leone and wanting to find ways to build collaborations out there to bring some of these innovations that came out of scarcity to address health disparities in the United States. And I think that's really exciting. And those of us who've sort of had the opportunity to work both globally and, in local environments as well, thinking more about this and trying to incentivize those opportunities, I think is really exciting. In terms of the dynamics, if you look at the youth readiness intervention and the evidence-based components, it's got a lot from group interpersonal therapy, cognitive behavioral therapy, a little bit of mindfulness. Not even knowing this, I found out many years later, the group in Chicago, you probably know the Becoming a Man program. And that's a very well evidence-based program for young men exposed to violence and at risk of getting involved in gang and other violence, that without us even knowing each other, we had selected pretty much very similar ingredients. Just by looking at what's out there, what can non-specialists do, how can we do it at scale with quality? And I think it's Sierra Leone, we've got like a version of that both for young women and for young men. And that would be exciting to see Becoming a Man also expand beyond, so that you've got young women. And I think partnerships like that could be so exciting because a lot of what we've learned to do, because we haven't had a lot to work with in low resource settings, we could be bringing back here to address topics of disparities in health equity.
Thank you.
Yeah, I can compliment on that. So yes, that's a fundamental question. Thinking about the US, right? Firearms are the #1 killer of children and teens, and that's been true since 2020 approximately. So, and following kind of like these logics of policies, I think what varies across context is what is imagined to be possible or not. So I'm thinking of gun carrying restrictions in Colombia, for example, and there's plenty of evaluations showing how gun carrying restrictions reduce homicides on the streets, but also decrease gender-based violence deaths within homes. And so there are plenty of examples where we could learn from different places. It's just that each place which will have its own kind of like politics and policy, and then again, the imagination of what is possible to deal with violence. And I think a second idea important to describe here is how we're all human. So of course there are similarities, more similarities than differences. So I really like this kind of like cross-pollination of ideas of what works in some context and what wouldn't. It's important to pay attention to policy and to implementation challenges. But in the end, I mean, there are workarounds for these problems.
Thank you. And to your second question, I say yes, the arts have a role to play. It used to be a bigger role in our public education, around character development. So the crisis of empathy, I think, could be addressed through the arts. So that was my response. Thank you.
Unfortunately, we are almost out of time, and I just wanted to make a few remarks to bring things together. If anyone does have questions, I please encourage you to come up to these folks afterwards. Other ideas come up, please reach out to these wonderful speakers. It's really hard to pull together 5 fantastic speakers and your important work, especially given the breadth of megatrends. It's just a tiny topic. But I can't get out of the gravitational pull of, I think, this crisis of empathy. And I think that, for me, would cut across a lot of what we're discussing here. Jorge, Diogo, Nikita, they, weren't afraid to name all of the problems in the political situation at the moment. And it is a moment where people are literally saying the human species does not need empathy. Which I find to be one of the most frightening statements. If we look at what's happened on this planet in the past 9 months or so, there were about 220,000 adolescents and children that immediately lost services in January of 2025. There were 14 countries that had their suicide hotlines immediately shut down, medication-assisted treatment programs for drug abuse that were shut off. And adolescents died because they couldn't get their methadone. So there's a lot of empathy that has been kind of decimated in this current moment. And I think what you're all bringing up is, how do we find ways to cultivate that and to think about it? Jennifer, what was really moving for what you were describing was how people in very different circumstances, maybe a student in the UK and your colleagues in Nigeria, to come together on a common understanding of what the impacts of climate change are going to be. And you show very powerfully, and you continue with your very impulsive program, that people can understand one another. They can feel their pain, whether that be guilt, whether that be hope, whether that be despair. So there's solid evidence that that is doable. Sean, you named this, so it's your job to help us find a way to fix it. But I think that issue of, we know that a big challenge to risks of suicide is thwarted belongingness. And when you don't have work, when you don't feel like you have identity and work in society, and I think Shoshana brought that up this morning too, kind of this self-blame, loneliness, isolation, all of these feelings, that's a product of not feeling like people understand you, right? That politicians aren't empathizing with you, others aren't really connecting with what you're experiencing. My colleague Georgia and I just did some work in Greece last week, and Georgia ran a focus group with some adolescents and said, our government's actions don't show us that they care about us. And a really interesting thing, when asked about what's most important to measure, they said suicide risk. They said, if you care about it, if it counts, you will count it. And a fear on the part of governmental organizations to ask adolescents about suicide, like, I'm going to upset them. No, it shows that you care about that. Theresa, and I, recommend everybody to read your book. The intergenerational challenges are there, but the strength, and some of these individuals who were child soldiers who are now running governments in a very effective way and making such powerful choices about where Sierra Leone goes in the future and being leaders in West Africa, shows that early trauma does not mean you don't get empathy, right? You can go through very, very awful experiences. It doesn't guarantee like that you will be an empathetic individual, and in some ways it may even cultivate that. And a lot of your interventions helped everybody kind of build some of that empathy after being through such difficulties. And Cecilia, we've talked for a long time about we can't impose these ideas, and I think empathy is the same one. How do we understand indigenous concepts of empathy? A big theme in this group is that social connectedness, of being part of a collective, and one-on-one interventions only get you so far if you don't do things in a group setting. And so many of these kind of indigenous concepts, really respecting people's ideas, show you that empathy is a collective experience. This is not an individualistic. And then, Johannes, we end with you in the future here, but what will LLMs, generative AI, do with empathy? And I think, what you began this session with, this is an incredibly powerful tool that could be really beneficial and do a lot of things to help, and also potentially harmful. And I think the ability of LLMs and generative AI to be training models, to really scale up these interventions and make them available to everyone around the world. We can train in so many languages. We have so much reach. So being a real tool for scale up, there's incredible potential. At the same time, and like you said, it's how you allocate your time. If our expectation is when we're distressed, when we're sad, when we're upset, we're going through developmental challenges of adolescence, that we turn to, the ChatGPT or some other LLM as opposed to another human, that has two consequences. One is you're not getting the experience of somebody else understanding you, but we're also depriving another individual of developing their own skills to empathize with others. When we talk about adolescence, and in huge part, it's about learning to be a human being, right? It's learning how to empathize and having that experience of helping others. And so if our expectation as a society is we, and Shoshana and others brought up this morning again, because of stigma, we don't share with others, we don't feel like we're burdening them, we're not giving somebody else the opportunity and the gift to listen to our suffering and our hardship. And that's how adolescents learn to be adults. And how we as adults learn to listen to adolescents and be able to help them kind of cultivate their future. So on that note, I want to put out a call to action to think about empathy, empathize with others. How can our programs be more empathetic? And just encourage all of you to reach out to these wonderful speakers. Thank you all.